But Maxwell Agbagba is somewhere around the Ministry of Health, and apparently a lot of nurses have been demonstrating. They've been picketing, that's the right word. And Maxwell is with one of them, solidarizing with them.
Japan should comment on that matter.
Maxwell, good morning.
It is not good.
Maxwell, good morning.
Good morning, Roland.
I'm told that you have some of the nurses who are your friends. Is that true?
Yes, good morning, Roland. So, that's very true, Roland. So, there are two groups of nurses, here at the Ministry of Health, and the two groups are actually, for one of the groups, they are picketing. For the other, they are here for a data capturing exercise. So for the group that you see behind me, they are a group of unposted private nurses, and they are here for their data to be captured, for them to be posted. Interestingly, their presence here actually caused some unposted nurses, coalition of government unposted nurses, they call themselves, attracted them here to the Ministry of Health to come and picket. And we are told that they've been picketing here since yesterday. Today we came here. Some of them are here and they are still picketing. We understand that the others are currently at the First Sutherland Children's Park and will be heading here in some minutes because they were manhandled by the police yesterday. We'll be getting those claims from them shortly because they are on the other side. And then this group of private nurses, unposted private nurses, are also here waiting for their data to be captured so that they can be posted. I have the president of the group and some other members. I want them to join me right now to have a brighter appreciation of exactly what is happening on the ground. So what's your name?
Yeah, good morning. I'm Frederick Barr. That's the president of the coalition.
Okay, so once again, we want to get a clarification. What's the name of your group?
We are a coalition of unemployed private nurses.
Private nurses?
Please.
Okay, so we understand that some of you completed your studies in 2012, but till date you've not been posted, and that's why you're here today.
Yes, please. As you heard it, the same. Yes, we some of us completed school since 2012, and we are still waiting for our posting. It was just last week, Thursday, that we heard from the website, Ministry of Health website, that there's a verification forms which we need to come and fill so that we can get our clearance to be posted.
Okay.
So you can see the number so huge here. Even yesterday, the number, we were about 2,000 people here. But we thank God, we were here, everything was moving on successful until our brothers came in picketing. So the process have to stop. But one way or the other, we managed to continue the process. So we are just continuing what we're supposed to do. That is the verification process. That is what we are still doing.
Okay. So tell me, from 2012, while you were still at home, how were you surviving?
It only God knows. As I was saying previously, it wasn't like that. Before the administration, that is the previous administration, that is the government. I'm talking about government. It used to be like they would take a quota of the private nurses, then they take a section of the government too. Okay. But when they came, they abolished the whole issue. They were just admitting the government nurses. So that is why I think it's creating a problem. Because if we were to be there as President Kufuor, all these issues won't be there, because now our friends are seen as as enemies, but which it shouldn't be like that. They take a quota of private nurses, then they take a quota from the government sector. Then we all go to the world and work together.
So which year did you complete?
Actually, I completed 2012.
2012?
Yeah.
So 2012 to 2018, you were not working as a nurse, and you're now come to start the process, or what?
No. I was working. I was working at a private hospital.
At a private hospital, but you want to be posted to a government institution?
Of course, everybody wants to be posted at the private government sector.
Can you help us understand what really is the difference between working in a private institution and a government institution?
Director, you and I know. Supposing you're working at the government sector, even the salary, the way they treat you at times it differ, because somebody you are working for an individual, the person can decide to sack you any moment from now. You understand? And you have a different behavior. Let's say you have a director who have a mood swing. Maybe he can talk to you anyway, like you feel like talking to you, but as a matter of fact, it might not be your fault.
Yeah.
So everybody want to be at the government sector.
Okay. So now let us understand this. So for all the people gathered here, I mean, I can see a lot of them right now. All of them working, or some of them are not employed? At least you are employed, you tell us.
Yes, some are working, some are not.
Okay.
Some are working, some are not. Yes,
Okay.
yes.
What percentage of them are working and those not working? Are you able to tell us?
No, at the moment I can't give you the actual figures and how many are working and how many are not. I can't do that.
What assurances have you been given by the authorities here that, I mean, the data capture exercise that is ongoing would result in, in the posting, in your posting?
Okay. Yeah, previously after our picketing somewhere December, we used to come here for a follow-up. So what they told us was, initially they used to have challenges. That is, when they come out with the clearance, it will end up the number that they want to admit will decrease.
Okay.
That one will be a deficit to the Ministry of Health.
Okay.
So this time around, what they want to do or what they want to achieve is make sure the actual number that they want have been captured.
Okay.
That is why they are doing this process, so that at least they can get the actual number that they want to give the posting or the clearance to.
I want to say a big thank you for talking to us. So you just heard from the president of the Coalition of Private Unposted Nurses. They are nurses who trained in private institutions. We understand that some of them have not been posted. Since 2012 they completed school. Some of them have not been posted. The president I just spoke to, you heard him talk for himself that he has a job in a private institution, but he wants to get into the public institution. So that's what is happening here. It's a data capturing exercise. They're hoping that they will be posted right after their data have been, captured. There's less action here. Now let's take you to where the action is, where the picketing is happening, right here on this compound. So this is the Ministry of Health compound. One compound, two different things happening. This group actually is the Coalition of Unposted Government Nurses, and they are here because they say that their colleagues, private nurses, are embarking, have been engaged in this data capture exercise, which means that they'll be posted very soon. They are angry because they completed school in 2015 and they are yet to be posted, and that is why they are here. They've been here yesterday, they are here today, and they are still protesting. So this is what is going on. This is not a full number. I'm told that some of them are at the Fort Sutherland Children's Park. They are there because yesterday some police officers came here and they claim that they were manhandled by the police officers. A lot of the workers here are not too excited about this situation because it doesn't really create a conducive atmosphere for them to work here. Let's get close up and speak to some of them right now. Sir, what's your name?
I'm Ibrahim Armial, the Northern Zonal President.
You are Ibrahim what?
Armial.
Ibrahim Armial.
Yes.
And you are the president of the
Unemployed Nurse Assistance Association, 2016 back.
Okay, so tell me, why are you guys picketing the Ministry of Health today?
Yeah, since our year of completion, we completed 2016, and we have submitted several petitions to the ministry concerning our posting, and they have given us sick promises every day that we come. They will say that they are working on our things, they are working on our issues. Every day, that's why they keep us doing that. We came out with a press release that we want them to state clearly that when are we going to be posted. We gave them 2 weeks ultimatum, but they failed. The 2 weeks came and passed. Then we sent them another letter that we'll be picketing on the 19th of February this month. We informed them and we wrote a letter to the police that we'll be picketing today. No response from them. Yesterday we came and picket. In the night, nobody, nobody from the ministry, even the minister himself, he was around, but he failed. Nobody responded to us. So in the evening, the police came and beat us and sacked us here. So we slept somewhere.
Two of us are in the hospital. Wait, you said two of you guys
are in the hospital currently, and one was with the police. The police commander himself was also here. Two of us are in the hospital, and we are just caring for them. Everything, those they chase and they run away. For now, we don't know where some of them are, but we are still calling to find out where they are. But all this we are doing is because of our posting that we are doing all this.
So where are you guys coming from? Where are you coming from?
I'm coming from Tamale, northern region.
You came all the way from the northern region. Where are you coming from?
I'm coming from Wa.
You're also coming from Wa, and then you?
Wa.
Now, tell me, you're also from Boku?
Boku, yes.
And we want to get assurance.
Tell me.
Response from the minister before we go back.
Okay.
And we are not going home.
Are you guys being fair to the ministry? Because they tell us that for this group of nurses who are, from private institutions, some of them have not been posted since 2012, but you completed in 2016. Yeah. They've given you assurances that they are, doing some financial clearance exercise. So you should be patient for them to complete that exercise. Then you will be posted. Why are you doing this? Why you want to wait? Why are you trying to stampede the process?
What's happening is that the ministry shouldn't be hypocrite. They are hypocrites. These people, this particular body was there. They went ahead and posted the 2015 batch. They posted them 2016. They never said that private nurses are there. Now it is our turn. They want to abandon us and post private nurses.
We have no problem with them. We have no problem with them posting the private nurses. They are also Ghanaians. They need to be posted. After all, they were giving those private institutions the accreditation. But our problem is that we attended the public schools. Some of us were bonded, others weren't bonded. But whether we were bonded or not, we still qualify to be posted. So we have no problem with them registering the private nurses to be posted.
But there are some of your colleagues who think that on the priority list of government, they should come first because they attended government institutions, they attended public institutions.
Yes, that is our stand. So it's batch by batch, it's year group. So when a particular year group completes, they need to be pushed, they need to be posted. They shouldn't wait till the next batch also complete and there will be backlogs there. Okay. They went to different school, we went to different school. So the proper process, the procedure that need to be followed should be followed. What needs to be done should be done well. Okay. They should discriminate and say they completed somewhere 2012. That doesn't matter. It's a different year.
Not to burst your bubble. I spoke to the minister some minutes ago, and he's not so sure when they'll be done with the financial clearance for you guys to be posted. I don't know how you take that news.
If that is so, then we are moving straight to the finance ministry. We want to know when. We want document to show when is the clearance going to be done. The incident that we are not going home until we have a document that will show that this particular day you are going to be posted. Else we are not going.
And it looks like you came prepared, your toothbrush and everything. What's this? How can a police slap a nurse demanding for posting? Is it what? Is it a crime to be a nurse? Is that what happened yesterday? They slapped you yesterday?
What happened? The police slapped us. They took our phones. Look, have you seen? Tear gas. They just and we are criminal. We didn't destroy anything here. We didn't destroy anything here. But he came. He warned us secretly. The police commander warned us secretly that in an hour time what will happen to us if we don't leave. And we told him that we are not leaving because we are doing it in conformation of the law. We are not doing it illegal. And we are all Ghanaians. We are entitled to our rights. But he keep on telling that in an hour time they will beat us.
But we didn't come here to demonstrate.
I don't think this is in breach of the Public Order Act. Did you write to the police?
We wrote to them. We have some copy of the letter that we gave to the police to notify them that we will be picketing here. They receive it. We gave it to the police command.
We are told that because of that, some of your colleagues are afraid to come here today.
Yes, they have run away. That they won't come. Some we don't even know where they are.
Whether they will beat them or not.
That's good. So, I want to say a big thank you for speaking to us. So, that is the situation here at the Ministry of Health, the presence of the Ministry of Health. A lot of the workers here are unable to go about their normal duties because they have to come out and see what is happening here. Two groups of nurses, all of them gathered here, one from the private institution. This group, they are saying they were trained in public institutions and have to be posted. They don't understand why their colleagues from the private institutions have been, are gathered here for a data capturing exercise. They completed in 2016 and they want to be posted immediately. They say they are not leaving until they are posted by the Ministry of Health. This is the situation here at the Ministry of Health, Roland.
And that's Maxwell Agbagba roving live from the Ministry of Health this morning. Is really interesting. Two groups now. Hopefully we don't get a third by the close of the day, but whatever happens, we'll bring it to you first here on JoyNews. Maxwell Agbagba there on the ground.